Hey, welcome back to Homestead HQ. This is Jason. As you can see tonight, Shelly is not with me. She is actually out of town for work, and I didn't want to do the podcast all by myself, so I brought in Chuck Peoples with Homestead Medical, and we're going to talk about medical and first aid stuff on your homestead or your compound or whatever you want to call it. But I'm going to bring Chuck in here in just a minute, but I wanted to go real quick with our sponsors, get all that stuff out of the way, and then we can spend the rest of the time talking to Chuck. First, one of our sponsors, one of my favorite sponsors, is VacMaster. VacMaster makes commercial chamber sealers and a line of butchering knives. They also make some kitchen knives that are pretty nice. I've got a couple of those that I use in the kitchen a lot. But if you go to VacMasterFresh.com and use the promo code and the affiliate link Homestead, that will get you 15% off your total order. Right now, they got some good sales going. Some of the units, if you buy those, you'll get a free stainless steel table with it. And they've also got the butchering knife roll that I check it out. I did a video on it. I think it's about $150, and then you get 15% off. But it's an awesome setup for butchering. Also, we've got Signature Solar as one of our sponsors. You can go to signaturesolar.com. Signature Solar has got some of the best prices for kits, any kind of solar stuff you're looking for, they've got it. So go check those guys out. And also Caliber Armor. If you go to caliberarmor.com and use the code Homestead10, that will get you 10% off your order. They make body armor, plate carriers, and stuff like that. So go check those guys out. And here it is. We're going to bring Chuck on right now. Chuck, welcome to the podcast. How are you?
Doing good. How about you?
Doing good. We've got Shelly is out of town. She's actually in Texas working. And I was like, I'm going to bring Chuck on and we're going to talk about some medical stuff. We're going to kind of fill in a little bit of the gaps. Our last episode, we did building a comprehensive emergency kit for your house. We touched on medical. So Chuck, we'll get into that in a minute. Kind of tell people who you are, what you've got going on, and why you can come and talk to us about medical stuff.
Well, my name's Chuck Peoples. I'm a critical care paramedic going on 30 years. I own a company called Homestead Medical, and I teach a variety of medical classes. Also sell custom-made medical kits. Classes kind of focus on we do all the stuff of the tactical cool guy ninja trauma stuff, and all the stop the bleed stuff, but we really focus on what do you do afterwards? What if you have to take care of somebody for 2 hours, 2 days, 2 weeks, 2 months, the prolonged care, and teaching those skills to people, everyday people. You don't have to have any type of medical background, so you'll be prepared for things like that.
Yeah, and you just got done with the class, didn't you, in Ohio last weekend?
I just finished one Sunday evening in New London, Ohio. I've been, the last month I've been to Tennessee twice, Ohio, and I'm getting ready to go to North Carolina.
All right. So essentially you'll kind of go wherever except for California and New York?
Or Illinois, California, Maryland, anywhere where I can't, have something with me that are my rights to have.
Yeah. And Chuck, you've done a class. You did a class at my place for several of our group members. You did the 2-day class. Kind of go over some of that. I mean, while we're here, tell them kind of what you're teaching and your background as far as why you can teach this and what they can look forward to if they take a class with you.
Well, background as far as what my knowledge is being a paramedic 30 years, I worked your traditional EMS, on an ambulance for over 20 years. And then I started working overseas. I worked as a contract paramedic overseas at various locations and learned more of prolonged and advanced care. Some things that we do overseas, you don't do as a paramedic here in the States. And then I've worked also in the States on some remote and rural areas where we had additional skills and protocols that we could do that most paramedics wouldn't. So the things that kind of got me thinking of teaching was a lot of people teach how to use a tourniquet and all those things, the things that'll kill you in 5 minutes or less, open chest wound, major bleeding, those type of things. But what do you do after you do that? What do you do after you stop the bleed? What if you have to take care of those people? And I saw a big gap in that. And also from working and being deployed several disaster areas, hurricanes, tornadoes, things like that, I saw where a hospital system can easily go down. Major cities, New Orleans, Baton Rouge, places like that, who have had hurricanes, who had no functioning hospital whatsoever. And people died as a result because they couldn't take care of some simple things, because they weren't properly taken care of and properly cared for. They died because they turned into big things, infections, things like that. And there's a lot of things people don't understand what happens when you have kind of a breakdown of that. And I try to teach all that and have people prepared for things that they can kind of make a difference and take care of themselves and their family members and people they care about.
Yeah, and I've been, before I even met you, I've been to a couple Stop the Bleed classes, and they taught, pretty much stuff that will kill you, within a few minutes and that kind of stuff. And I'm like, that's great. That's awesome to have. I've done a bunch of that, and you cover it in your class too, which, I mean, everybody needs to know that basics right there, in my opinion. But I like that you're doing more of the homestead stuff and more prolonged care. There's a void in that market, and it's nice that you've got that covered. I mean, it's great. We're looking to be more sustainable, more self-reliant and stuff like that. And medical is one of those things that, just treating, like you said, when the hospitals go down, as far as taking care of some of your own people or yourself, there's small things and small steps that you can do right now to, make sure that you can handle small emergencies, stuff like that. Not that we're going to go, do major surgery or anything like that. I mean, that's beyond the scope of what I've got at my place. But it's nice that we can take care of somebody. If somebody cuts their leg with a chainsaw and in a disaster area and you can't get to the hospital, that we can take care of that at least until we can get a higher level of medical care.
Well, even some of the things that I teach are some minor surgical skills, such as wound debridement with instruments and things like that, and a few other things that you can learn. But yeah, that is what's going to happen. And really, it could start off as a little cut, but you don't take care of that and do the proper wound care management. And, because in something like that, people are going to be taking care of their land, taking care of their animals. Well, there's a couple of things. You'll cut yourself while taking care of your land, fixing a fence, doing whatever. And then you got to go take care of the animals. Well, there's one thing that is always that you're going to deal with and be knee deep in when you're dealing with animals, farm animals. That's poop. Poop breeds an infection. And that little cut gets infected, and then you don't properly take care of it. And then it becomes systemic. And next thing you know, you're septic in septic shock, and sepsis runs through your bloodstream and you die. All from something that could very easily, with a 2-day class, you could learn a lot of. And if you happen to have medications on hand, or you do something like Jace Medical or Contingency Medical or something like that, and you have some antibiotics and a stockpile of antibiotics, you'll know which antibiotics to take, what the proper dosages are, when to take them, how long to take them.
Yeah, exactly. And that's one of my biggest gripes is that most of these classes, they take you from the problem, they take you to step A, and then step B is a higher level of care. Well, there's not always going to be a higher level of care. You're going to have to be step B some of the times.
Well, that's great. You put that tourniquet on. Now, what if you don't have help for 24, 48 hours, or whatever? That tourniquet has to come off at some point. Yeah. And we're going to have to give supportive care, because if you put that tourniquet on, they've had a large blood loss. Well, they're going to go into shock. Now you have to treat and give supportive care for shock, but also, when do you take that tourniquet off? Do you know how? Do you know when to convert it? Because ideally, we want it off within 4 hours. If you're not at higher medical care, what are you going to do? Can it stay on longer? It can, but we would want to convert it. And tourniquet conversion and how to actually remove a tourniquet and things are things that we cover. If you have the proper resources to provide the supportive care also. And those are the things we teach. I could take somebody who can't spell CPR, and within a 2-day class, they will be doing minor surgical procedures at the end of it. It's just skill and knowledge. It's not rocket science like our modern medical society has us thinking. Now, I'm not a doctor. I don't proclaim to be a doctor. I'm not an expert, nor do I proclaim to be. But I do have skills that I have practiced over the last 30 years and knowledge that I'm just passing on. And that's what it is. Skill and knowledge to pass on to people so they can be more self-reliant.
I'm not a doctor, but I'll take a look at it for you.
Yeah.
that I stayed in the Holiday Inn Express last night,
right.
Or whatever that commercial is. Yeah, and we had a conversation a while back as far as, removing a tourniquet and stuff, because I asked you, I'm like, Chuck, really, in a grid down situation, if you have to put a tourniquet on, is that pretty much a death sentence unless you've got a full suite, of medical stuff sitting at your house? And you had told me something, if a tourniquet, there's ways to do it. If a tourniquet stays on too long, the blood on the downside of that tourniquet, it dies or something like that.
Yeah, the tissue can become necrotic because of lack of blood flow. And so ideally what we'd want to do is, tourniquets are taught in most classes as a hasty tourniquet, high and tight. You put it all the way up on the limb, as high as you can, as tight as you can. Well, it may even be because you've got a radial artery that's cut. Well, once we get to a stable area and we've got more hands, or we've got more resources that we could treat, we may want to convert that tourniquet to where it's only just a few inches above that wound and restore blood flow to the good tissue, to the part that's unaffected. And then once we treat that wound and showing skills on how to treat the wound, how to assist with clotting, those type of things, so we can tell if it has stopped bleeding, if it has clotted, and if we're prepared for that, we can then slowly, step by step, take that tourniquet off. And those are the things that I teach. And then we have to deal with that wound, whether we're going to close it, we're going to do a delayed closure, or we're going to leave it open and do wet to dry dressings and wound care, to let it heal that way. So there's a lot involved, but it can be taught in that time. I do a few different levels of class, level 1, level 2, which is far more advanced. And then I also do some other things, but it's pretty easy to do, because the one thing is, a lot of people don't put emphasis on medical. It's not sexy. It's not cool. You're not shooting guns. You're not doing, all that other stuff. But the one thing is, you have to eat. You have to have water. You have to have shelter. You will use medical. At some point in time, you will use medical.
And you're going to use medical probably 100 to 1 over a firearm.
Always. Yeah, you may never, ever use a firearm. Train with it. Be prepared. Absolutely. I don't deny that whatsoever, but you will use medical. I mean, that's 100% guarantee at some point. It may be minor, it may be major, but you or one of your loved ones or somebody you care about or somebody within your group, you'll have to use it. And most of the time, people aren't prepared and they panic. They panic and everybody's yelling and screaming, running around with their hands over their head going, somebody help, and there's no somebody. Yeah. And they take time to prepare, take the training, and have the resources and equipment.
Oh, yeah. Well, we had a ball game last night. And it's not, we weren't doing any high-speed ninja stuff or anything, but I've got a bag that stays in my wife's car, in her SUV. And one of the parents got stepped on. They had on flip-flops, and the kid stepped on her toe with the cleats, and it just raked the top layer of skin off. And I was like, come here. I was like, I've got Band-Aids. I said, we can get you fixed up. And so she got a Band-Aid on there. I didn't save her life, but it made her more comfortable, throughout the night. There wasn't dirt and grime and everything else getting in that wound.
Well, exactly. And that's the whole point of just having something as simple as a Band-Aid. Could have let that cut go. But as you said, throughout the evening, dirt, grime, everything. Part of bandaging is protecting the wound. Yep. And that's part of, and preventing, it's also preventing more dirt and stuff. Anytime you open your skin, it's going to get infected. You may have a little cut on your hand, arm, something that you don't do anything with. You don't even put a Band-Aid on, but you'll notice as it heals, it gets a little red around it. There is some sort of infection in there. Your body can naturally fight some of that, but that doesn't necessarily mean it can and will. So by bandaging it, you're protecting and preventing further debris and further germs and bacteria to getting into that open wound. And that's just an opening to your bloodstream. Yeah. Anytime there's a cut, an opening in your skin, that's an opening to your bloodstream.
Yeah. And I mean, if it would have been a worse injury, of course, there's stuff in that bag that you can treat. You know, if it really went in, luckily he didn't get it too hard and grind down on that toe. But I mean,
Right.
if it was worse, I had gauze and bandages in there. We could have bandaged it up. Everything
Right.
would have been fine. And that is, you're going to use medical a heck of a lot more. I mean, I'm a contractor. I cut myself every day. I mean, I will probably use 2 to 3 Band-Aids a week at least, depending on
Right.
how good I am with stupid stuff. So, I mean, hell, I was putting on some casing the other day, and I was holding a piece of casing and shot a nail, and it went in maybe a 1/4 inch. It went out to the side and hit my finger and went in maybe a 1/4 inch. And I'm like, oh, this is gonna suck. But I was like, it's good. It only went in a 1/4 inch. I'm good now. So
Yeah, and that's the thing is it's that prevention. But what if that wound got infected? What if you
yeah,
couldn't get to conventional medical care, or it's going to be delayed for several days? Having that training and having those resources and it doesn't take a room full of stuff. You're more likely to need a room full of gauze and Band-Aids than anything else because that's what you'll use the most of. But having the resources, because you can have a medical kit as small as this, that, these are the things in here that will take care of something that'll kill you in 5 minutes or less, or you can have something the size of a backpack. But in that, you can have things that will be able to close wounds, clean wounds, do all that properly, and all the other different stuff that you're going to, that you could experience, because medical emergencies happen also, whether it be something simple as the flu or a urinary tract infection or a heart attack or a stroke and all that. That's still going to happen also. Are you prepared for those things and have the knowledge that you can treat it?
yeah, and I mean, we'll kind of shift gears. Like the last episode of the podcast, we hit on the comprehensive emergency kit, and the first aid was part of it. What would you advise? We won't dive deep into a total grid down situation right now, but your average person that's wanting to get prepared for, let's say, a tornado, natural disaster, something like that, where we're going to say that they're going to bug in. That's kind of the way we put it. You're going to bug in. What would be something for a 3 to 7 day kit that you could build, but that you could also expand on? What's some stuff that you would want to see and not break the bank? I mean, no CT scan machine in this.
No, it's small goods. It's stuff I could put a kit together for somebody for that. Number one, you need a tourniquet. Having a tourniquet, this is something that you need to put on within 90 seconds or less, or you're going to bleed to death. Now, most people say, oh, well, you don't bleed out till 3 to 5 minutes or so. True, but you'll be unconscious from blood loss within 90 seconds. So this is something that you should have practiced, and it is something that you need to have. I carry one daily. This is the one I just took out of my pocket. I have it with me daily because it's that important. Bandaging, stuff for heavy bleeding. A trauma dressing, which is something for a long cut, large cut, which is nothing more than a large pad, gauze pad, and something that can tighten it up to allow pressure, like an ACE bandage. And they're just tied into one. Wound packing gauze that you can pack that wound first. If you have to put a tourniquet on, you're going to pack that wound to assist in clotting, to assist in stopping the bleed, and to protect that wound channel. This will add additional pressure and help with it. Those are the first things you should have. The other thing, chest seals for penetrating chest wounds. That's something that can kill you in 5 minutes or less, a open chest wound, and it's very simple to use. They're not expensive. I'm talking all of this right now between the tourniquet, the bandage, the wound packing gauze, and you should really have 2 of these, not one. And the chest seals, 10, let me see, 15, 25, 35.
Less than $100, right?
$35, $65. We'll buy all that. And those are things that'll kill you in 5 minutes or less.
Yeah.
The other things that you're going to need after that is gauze. different types of gauze, whether it be 4x4 or 2x2 pads, rolled gauze, you know, that bandaging gauze. Usually 4-inch is probably the best thing to start with. It's utility. You can go up to 6-inch. You can go down to 2-inch. But 4-inch is probably the best utility one to have. And lots of gauze. When you think you have enough, buy more. And you could also use that gauze to pack wounds. This is just nothing more than a more densely woven gauze that assists with stopping emergency bleeding, the wound packing gauze. But you don't have to use it in a femoral or any type of an arterial bleed. You could use this on a large cut like a chainsaw. It may not hit an artery, but it's going to bleed heavily and there's going to be a lot of tissue. You could still pack that wound with this to assist it in stopping bleeding.
And really with that, it's a Z-fold gauze that's been vacuum sealed.
Yeah. So, yeah. Well, and it's a tighter weave in the in regular gauze, but you could still use regular rolled gauze. And then, you know, when you get that, some medical tape. I advise cloth medical tape. It sticks better. It's more heavier duty than the plastic. And then we're going to go in there from the different types and sizes of gauze. Now, I know everybody wants to go out and get a bunch of creams and this and that and the other. Back to tracing is your best bet. The triple antibiotic cream is not the best for cuts and stuff. And no, you don't need all the saline and sterile water and you know, iodine or peroxide. Peroxide can be necrotic to tissue. We don't want to pour that on into an open cut. More for something like a scrape or what's referred to as an avulsion. Stock up on water, just regular bottled water. If you can drink it, if it's safe to drink, it's safe to irrigate with. Yeah. And it's having that knowledge and having those tools to irrigate wounds with, as a syringe, as some longer Q-tips. And I'm not talking about the kind that you stick in your ear. These are more for wound care. Having some wound care instruments and things like that to where you can flush out these lacerations and stuff and get debris out so we know we've got a clean field to work with before. Having the things that, you know, other things to have to treat burns. People kind of forget about burns. And that's something that you need to have in case. What if you do have a burn? Well, do you have a burn dressing? Do you know how to do it? And it's a wound, but it's a different type of wound. But even things like minor burn gel, and there's a couple I sell that are water-based that do cool the burn and take it out, but it's the steps of knowing. A lot of this goes back to before building your kit, you need to have the training. Because you can have you could have a warehouse full of stuff. You know how to use it, it's useless. I would then we can think about, you know, musculoskeletal injuries. A SAM splint, most utility type thing to have, can fold up compact. You can get them in different lengths from finger size, 24-inch, 36-inch. You can get a kit. I sell a complete kit that includes all those, and ACE bandages. You can effectively immobilize, say, a sprained ankle, a sprained wrist, even a broken, you know, a fracture of a leg or an arm, that you can immobilize, because immobilizing is going to, number one, help with pain relief. It's going to prevent further damage, and it's going to get it. And if it's not an open fracture, if it's just, you know, a what some people refer to as a hairline fracture or even a green stick fracture, it can help promote healing because the body heals a lot on its own. Going back to the lacerations of having that equipment and the wound care equipment is, what if learning the skills to know to close it? The best thing I can think of for a Homestead is a skin stapler. Yeah. You know, it's the best thing to have. I could teach this very easily.
I mean, realistically, if you can use a regular stapler, like a paper stapler, you can use a skin stapler.
Sure. And you know, you saw it in class. You got stapled. Yeah. You know, Shelly was knocking people over trying to get to you to staple you first.
Yes, she was. That's the fastest I've ever seen her move before.
That's right. She jumped up on standing by your side before I could say another word. But, you know, it's an easy skill. It's not as evasive as as suturing, because suturing's an art. And I could teach people to suture, but it's very basic, and it's the stuff I've learned. And I don't begin to go into things like inner sutures and stuff like that. Those are surgeons. Those are plastic surgeons, and they obviously have a skill and the knowledge of the training to do that. But you could do something as of ditch medicine. You know, it's your last ditch effort. What do you have to do? We don't have any help coming. You are the help. You're your own first responder. So you're the one who's going to be doing that. And then also dental emergencies. Do you think about emergency dental? I don't care how big, bad, or tough you are. I mean, even on the weekend, if you've got a filling that falls out and you've got a dry socket or something, I don't care. That's going to take you out. Try finding a dentist open on the weekend.
Yeah.
Because the emergency room isn't going to take care of it. You can't go to the ER and do that. You know what they're going to do? Give you some Tylenol and say, we'll make you a dental appointment for Monday.
Yeah. Oh, yeah. And the skin stapler, I've been stapled without any lidocaine or anything, and I've had my finger stitched up without any lidocaine, because last time I got my finger stitched up, I waited a day, and I knew the doctor, and he was a little irritated at me that I waited so long. So he didn't numb it all the way, and at the end, like the last 4 stitches, I could feel every bit. And I was like, dude, that hurts. And he goes, you should have came in yesterday, Jason. And I was like, thanks. But I would much rather have that skin stapler done to me than the stinking sutures. And I've had both of them without lidocaine. And the skin stapler, hands down, I would take it.
It's a little pinch. And by the time you put one suture in, now obviously a physician or something who sutures every day, they're going to do it quickly. But by the time a layperson would put one suture in, you could have a wound closed with the skin stapler.
Yeah,
it's very quick, and there's obvious skill in it. It's not something that I go over in 5 minutes. You know that we go through a lot. I mean, it's a big portion of that class is wound care, and stapling's the easiest part to teach. It's everything you do prior to and evaluating that wound and cleaning that wound and prepping that wound to be closed.
Yeah. And it's not too. Everybody's like, oh, you know, you got a big gaping wound. We need to close that thing right now. That's not always how it goes.
No. And, you know, of course, I'm not saying this is going to be a replacement for seeing a doctor. This is something when there are no services, you know, and this is not something I can certify somebody in where they can go out and open Joe Blow's Wound Care Clinic. This is something that, you know, for their informational purposes only. You know, I'm always going to advise you to seek, you know, a higher level of care, seeing a physician or a PA or a nurse practitioner or something like that. But you got to think about when disaster hits your community, those people live in your community. They're affected too. Their homes are affected. Their families are affected. They don't show up to work. They're not worried about, you know, doing that stuff because they've got to take care of the same disaster that you do. And emergency services are greatly affected. They're reduced, if you have any at all, depending on the size of it, and your help is coming from far away, and it's not FEMA. It's going to be 72 hours, and that's FEMA moving at lightning speed to get help there. You know, and so being prepared for that and having a well-rounded stock kit to last you a week or two, and the amount of gauze, if you think a few rolls of gauze will be enough to take care of a wound that you have to do wet to dry dressings on and pack that wound every day, it is not. It's going to take 7 times more than what you think.
Oh, yeah. And another thing, too, as far as with the training and stuff, I mean, a facet that I see of it is if somebody has a wound, say you're on your homestead, everything's good. We could run to the emergency room or we could run to the walk-in clinic. If I get injured, I've got the knowledge and I can look at that wound and be like, hey, this is something I could treat, or I need to go to the doctor.
Well, and I've had multiple students who've said that, hey, you saved me a $3,000 ER bill. And I've had students say, hey, you saved me a $1,500 large animal vet bill. Because now this is also transferable over to animals. Of course, there's some differences in anatomy and stuff, but they're able to evaluate and stuff. Says, hey, this is something I could treat on my own. It's not that bad. I know how to properly take care of this. Or, oh no, this takes the skill of a doctor. I need something. And I've had multiple people, you know, to do that, to take care of large animals and things like that, to do it. Now, I mean, I don't think you're going to do it on a chicken. You know, to me, an injured chicken's going to be dinner. But, you know, all this will help. And you're exactly right. Now you're going to be able to look at something and go, when you're like, I don't know if that's going to need stitches or not. I better go. And you go in and they go, no. And they clean it up and they put a couple of Band-Aids on it, or maybe put butterflies on it. And then they send you on your way. And then you've got a $3,000 bill.
Yeah. And you'd been better off just staying at home and closing
Yeah.
it up.
And with a minor wound like that, you're going to sit in the lobby and you're going to wait and you're going to wait because they're going to triage that patients coming in. And if they're busy, that's not an emergency. You're going to wait.
Oh yeah, hours and hours, if not.
Right.
You know, I've heard people sitting in the ERs anymore, even in Bowling Green, for like 18 hours.
Oh, that's common occurrence every day. You know, where people are waiting.
I'm like, hell, the wound's already started to grow back after 18
hours.
Right.
It's right.
Like I'm halfway healed. I might as well just go on home.
So, you know, there's a healthcare crisis, and that shortage is over to EMS. You know, it also goes into part of that planning should be, how far away are you from help? Do you live in a rural area? Do you live in an urban area? How long does it take EMS to get there? Where's the backup? Are they paid? Are they volunteer? You know, what's their response times? All those things come into a factor, and most people don't even know. They just think they're going to call 911 and help is going to come. Well, if they're volunteer, that doesn't guarantee anything. It is what it is. It's volunteer. Somebody's got to volunteer their time to come out and help you. It doesn't necessarily mean they have to. You're not guaranteed help that way. And it may be the next town or the next town after that over, depending on if they have people available for mutual aid.
Yeah. So we're looking, if we started our our starter first aid kit to have in the house, we've got tourniquet, we've got wound packing gauze, we've got a trauma dressing, and then we've got chest seals.
Yep.
And then of course you're going to need, and just starting out, you know, if you get a good pack, I think if you get a case of gauze right now, that's probably more than 90% of the people have in their house.
And a case of gauze is, I think I sell a case of 4-inch rolled gauze, and it's 96 rolls of gauze is what a case comes in. I believe that's $60. I think. Which is a lot, but a box of 4x4s is, and that's 100. The ones I sell, 12 ply. You get 100 4x4s, $6-7. 100 2x2s is $3, $4, $5, $6. You know, somewhere around there. Band-aids, I would buy hundreds of Band-aids just to have. You know, you're never going to not use a Band-aid. And then the other little ancillary stuff, you could have all of this easily, depending on how big your family is and how you want to get into. And if you want to add things like skin stapling and things like that, you know, I sell a kit for that. It's, you know, $350, but it has a lot more extensive stuff, and it has 4 different types of wound closure devices in it alone. Along with all the things to clean it, along with the syringes, you know, all those things. But you could realistically spend, you know, I could put somebody a kit together for $200 that would be well stocked, that they could take care of themselves easily for a week. And that would fit into, you know, a small bag. You're not talking a giant bag, or, you know, even a tote. You know, like the big kit that I was talking about, I sell for $350. It comes in a 5-gallon tote.
Yeah.
Small, easy, you know, easily marked. You know, it's yellow and black. You can easily mark it, and it's easily identifiable. But I'm actually going to start putting them in a red container. So it's something that, you know, you could find easy, and you have all those supplies right there that you need. Have that and some bottled water that you set aside for wound cleaning, just in case you don't have running water. You go buy a couple cases of bottled water, you're set. You're set for that. You could take care of a moderate to even major wound for a good week if you couldn't get to help.
Oh yeah, and there's little stuff too, like tweezers.
Yeah,
I mean tweezers.
Yeah, and that's what I meant by the instruments. You know.
Yeah, fingernail clippers, some syringes for cleaning wounds out, like that. I mean, I know when I need a pair of tweezers, I don't want to hunt all over the house for a stinking pair of tweezers.
No, and the tweezers you use to pluck out a hair is completely different what you're using for wound care. You know, and they're a little bigger that, you know, you can angle. And I put in there the tweezers, a hemostat, some iris scissors, there's trauma shears, and all these things. And one of the other things you need, and I always say, is put a headlamp. Get a headlamp and put that in there, because, you know, you need to work with your hands. If you can't see, you don't want, you know, holding a light and, you know, a simple headlamp. I keep one of these in every single kit I have, you know, and you want something that the benzol and the lamp itself rotates down. So when you're wearing it, you can see, you know, and you can angle it so you're not hyperextending your neck. It's comfortable on you to work, and you can see the field that you're working in. So it's little things like that, but it really doesn't cost a whole lot to be really prepared medically and have a pretty extensive medical kit. But you know, I first invest in the training, because like I said, I can sell you thousands and thousands of dollars of equipment, high-end equipment, you know, diagnostic equipment, things like that. But if you don't know how to use it and you don't know what to look for, it's useless.
Yeah. Oh yeah. That and keeping everything together.
Yeah.
I mean, and not hunting for it. It's not like, oh, I know where the chest seals are over here in the dining room in the china cabinet, and then my tweezers are over here by my makeup stand, you know, and then, you know, oh, the tourniquet's over in the barn, and then stupid stuff like that.
And the thing is, I would highly advise one tourniquet may be enough. You know, in teaching tourniquets, if a tourniquet is applied properly, tightened properly, as tight as it'll go, and the bleeding still doesn't stop, the thing you're taught is apply a second tourniquet right next to it, right up against it. So, you know, one is none, two is one. Now, I'm not saying you have to have that for everything, but have those things. And then there's a list of, you know, over-the-counter medications.
Yeah, I was going to get to that. Give us like a short list of OTC meds.
Well, of course, Tylenol, ibuprofen. What you can tolerate. And ibuprofen is ideal because if you can only have one, not only is it a pain management, it's also an anti-inflammatory. So if you have a soft tissue wound of some sort, it's going to assist with both. I would also have like Bactracin for like what most people would refer to as triple antibiotic oil. That's cream. That's not the best stuff. Have that. You know, simple things like, you know, your flu and cold medicine and antihistamine. The big one I would say is Benadryl, the over-the-counter Benadryl, because not only is it for, you know, people may use it because of their seasonal allergies, but what if you're allergic to a bee sting and you have an anaphylactic reaction? 50 milligrams of Benadryl is literally one of the treatments they still use today. They just give it IV, you know. But having Benadryl, a stockpile of, you know, like antacids, you know, things like that. Comfort medications, basically. It's things
your anti-diarrhea stuff.
Yeah, anti-diarrhea. Now, diarrhea is a little bit, we go over that because there's a time to let it go. And then at some point we have to stop it if it keeps going, because really you want to let diarrhea go because there's something inside of you that needs to get out, some sort of bacteria. We want to let it go. But after about 48, 72 hours, well, wait a minute, we got to stop this. This is getting too bad. You know, having some sort of rehydration, you know, powder of, you know, I like liquid IV. Having something like that, if somebody gets overheated, dehydrated, we have something to assist them with that. Having something if somebody, their glucose level, their sugar level gets low, you know, oral glucose, you can buy that anywhere at any pharmacy or anything. You know, and again, just like I said, the comfort medications of, you know, the antacid, those type of things, you know, allergy medications, and have that, which doesn't take a lot. You know, we're not talking about spending thousands or hundreds of dollars on medications. We're you know, it's going to the pharmacy and picking up a few things and having extra. One of the other big things is to have is soap. Have extra soap that you put in there to clean wounds with it. You can, because the biggest preventable measure you can get from keeping disease away is washing your hands. It's nothing. And I'm not talking hand sanitizer. It's probably one of the worst things that's been pushed on, because what hand sanitizer does, overuse, you lose your natural immunity. Soap and water is the best thing to use to provide that, to be able to wash your hands. You know, and then, go ahead.
I'll tell you, one of the biggest things I keep in my medical bag in the truck and in both vehicles, and I keep one in the door of my truck, is one of those. It's Benadryl makes it. It's one of those insect sting pins.
Yes, yeah. The sting bites or bite relief, or, you know.
I got lit up the other day. I was doing something on a lady's gutters, And man, these yellow jackets came out and just lit me up. And I'm like, holy crap. So I jumped off the ladder. They got me on the back of the neck, and I was just putting that on there in like instant relief. I was like, these things are gold.
Yeah, and it is, but also Benadryl will help with that, believe it or not, because it is. But yeah, but even taking something like ibuprofen, because not only is it going to help with the pain, it's also going to help. It's an anti-inflammatory. It's going to help with that swelling where that sting site is that's causing that point of contact pain. So there's, it's kind of common sense. If you think about what things should I have? What do I have in my medicine cabinet right now? What if I get a cold? What if I've got heartburn? What if I've got an upset stomach? It's those type of things. Think about what could happen, or maybe something that's common for you, and have that on hand. And then don't keep it in because you'll run out of it at home, of your usual stash of what you do when you keep it in your medicine cabinet. And go, oh, I'll get that tomorrow. Oh, I'll get it the next day. I'll get it the next day. And you'll never get it. Then you won't have it when you need it. Have a separate stash in with those medical supplies of all those things. Doesn't have to be bottles of it. One little bottle, or some some single dosages of it, half a dozen dosages or whatever. Yeah. Have those things there separately, so if you do need them in something, it's there.
Yeah, and I keep a ton of poison ivy cream.
Yeah, hydrocortisone.
Yeah,
and then there's also natural remedies that you can get for that. Comfrey salve, and there's all these different salves and tinctures that people make that are great for that. Pine tar salve is great. If you find somebody making that, is great for poison ivy and stuff like that, to dry stuff out, and it draws those toxins out of your skin.
And that kind of shoots us in to the festival. I mean, we can talk about that for a minute. You're going to be teaching our festival. If you can get all the information at KentuckySustainableLiving.com, all the info is there. Chuck is going to be teaching a half-day wound care and a wound closure class. Yep. And then also Leslie, right after that, Leslie is going to be teaching an herbal apothecary class on medicinal herbs and stuff like that. So you're going to get a bunch of the medical knowledge, and then you're going to get a bunch of the herbal knowledge as far as medical herbal knowledge. Chuck, tell everybody kind of what you're going to cover in that class.
Well, I'm going to cover cleaning those wounds. Now, it's a 4-hour class. So it's going to be kind of a snapshot of stuff. I actually go into more detail in one of my longer classes, but we're going to talk about cleaning a wound, and then we're going to go over some closure methods of using the zip stitch. And I don't know if you're familiar with the zip stitch type things, where it's adhesive and zip ties, but it actually closes wounds. These are FDA approved. We're going to go over those methods, skin stapling, and we're going to go over a little bit about suturing. 4 hours is not long enough to do a full suture class, but we're going to go over just go over, kind of touch it, and we're going to let people practice these skills for knowledge. But the biggest thing is cleaning, prepping the wound, and evaluating it. Do I close it? Is it delayed closure, or I've got to do some debridement, or are we going to do it open? And then I'm going to talk about some of the medications, antibiotics and stuff, that if you had on hand, what to take, and dosages, how long, and all that, where Leslie's going to go into some of those natural things that you can have and that you can make and use to do that, like yarrow to help stop the bleeding, and things like that. So our classes are going to be a little bit hand in hand together with that. So you can take the modern stuff, but what if you don't have those medicines? Now you have a way to make your own, or you have plants growing in your backyard that you can use to assist you.
Yeah, and that's going to be awesome, guys. If y'all are interested in either one of those, go to the website, sign up for those. Those are going to be Friday before the festival, which will be the 25th, and the festival is the 20th, or I think it 20. I don't know. It's sometime.
Hold on, let me look.
26th and 27th, I think.
Yeah, 26th, 27th. The classes will be on the 25th, and then I guess you've got me speaking at some point on my speaking topic during the conference. I'm going to do a talk about the pitfalls of your medical kit, what to get and what not to get. Because when you start looking, you do an internet search, there's a lot of stuff people push and say, oh, you have to have this, you have to have this, trying to get you to avoid things, or some of the wives' tales of things. Oh, you have to have this, you have to have that. What you need, what to wisely spend your money on, and what not to waste your money on.
Oh yeah, and a lot of these medical kits, a a 500-piece medical kit, 490 of them are Band-Aids. And it's like,
exactly.
Hell, I could have saved my money and bought a real medical kit. You know, I mean, Band-Aids are cheap. I mean, I order Band-Aids by the, box load is what I order.
I literally order them case, like the last case I ordered, I think it's 2,500 Band-Aids, I think. So, I do that, and I'll have several kits, different wound care kits, the complete Homestead medical kit, like I was talking about. I'll have all the different versions of kits and components for sale because we'll have a vendor booth there also. Yeah. And to be able to answer people's questions, talk to them, you can just approach us and ask. I mean, that's part of being there. We'll help you out every way we can.
Yeah. And the festival website, once again, is KentuckySustainableLiving.com. Will be the 26th and 27th will be the festival dates. The 25th, the Friday before, we'll have our workshops. We've got other workshops. Everything is up on the website. Chuck, tell everybody where they can find you at.
Yeah, my website is homesteadmedical.us. You can get on there and contact me. There's several ways on the website. Just hit contact and it directly comes to me. And that will list that'll link you up with my store that has all the kits and equipment and stuff on there, list of classes that we have and upcoming classes that are already scheduled. And you can contact me if you're interested in hosting a class. I'll come to you depending on your location. I need some places, if it's closed, it's 6 students. Some places I need 10 student minimum. But there's not a time limit. Jason will tell you. If you all want to go 10 hours, 12 hours in a day, we'll do that. We go until it's done.
Yeah, we pulled about 2 10-hour days when we did it at my place. So, but we were comfortable in the nice heated shop.
Yes, we were.
Everybody was happy. So,
with a nice wood burning stove and a nice comfortable area, and it was a good time. I'm ready to come back to teach level 2 now.
Whenever I get time, we don't have anything going, so we got all kinds of free time. But guys, check out the website. We appreciate y'all being here. I will put Chuck's website in the description below so you can go check him out, and then make sure you come and see everybody at the festival. We appreciate it, and we will see y'all next week. Bye, everybody.
See you later.